we're really glad you could all be here. I've been looking forward to this conversation for weeks now, and I think you're really going to find it very useful. You're hearing my voice on the left. It's Diane Oikels, and I am based at St. Francis Xavier University in Antigonish, Nova Scotia. It's a beautiful sunny day. My colleague Ashakor is a knowledge translation coordinator who is based out of Montreal. We have a distributed staff in several locations across the country, and she is pulling technological strings. You'll likely not hear her voice, but I really want to thank her for her massive help in getting all of this set up and running successfully today. As you know, we are one of 6 national collaborating centers for public health distributed across the country. We're the only one on the East Coast. We are at NCCDH.ca if you want more information about our National Collaborating Center for Determinants of Health. Most importantly, before I say anything further, I want to acknowledge with gratitude that we are located in Mi'kmaq, which is the ancestral and unceded territory of the Mi'kmaq people. It's always very meaningful for me when I do a land acknowledgement, and this has become quite common practice, which is wonderful. And it may seem common for some people, but for me, I grew up in Nova Scotia and I went to St. FX, and for many, many, many years I had really very little idea of the Indigenous history and culture and communities that surrounded me. And so I think about that every single time that I do this land acknowledgement, and I think about why it's important to do and what I've learned myself about the importance of this, and I continue to learn. So I also extend this to First Nations, Inuit, and Métis communities across the country. We're a national organization, and I am very, very grateful to be here. And this is a little bit about our National Collaborating Center for Determinants of Health. As I said, you can find out a little bit more about our from our website. So today we are talking about community engagement. These are our 3 main webinar objectives. When you go to fill out the evaluation, these are the objectives I would ask you to refer to see if we've done what we set out to do today. You should know that myself and the 2 speakers have developed this content together. And you know, this I've got a real passion for community engagement, and I'm starting to notice some familiar names signing in, people that have taught me a lot, people that have lived with inequities and have taught me a significant amount about the importance and the strength of the knowledge and expertise that comes from community lived experiences. So I want to acknowledge that and thank them for that, and know that there is real passion on the part of all 3 of us today that comes into putting these objectives in this session together. So I will offer some links here to some resources that we have posted on our website and in our resource library around community engagement. The one I forgot to put here was the summary of the rent-safe research findings. I know there are a couple of people that are part of the rent-safe research team that are on right now, and I would encourage you to, when you go to the resource library, type in rent-safe, and you will get some wonderful results from that research project. And with that, I want to thank and acknowledge and introduce our 2 guest speakers. These are 2 ladies I've met in different venues over the past probably about 6 months, and I think have some really practical things to bring. So Heather Chase is a community developer with Horizon Health New Brunswick. She is in a small community of Black Harbour outside of St. John, and she is very focused on the people component of her projects and communities. She has a 25-year background in community development, intergovernmental relations, human resources, workforce development. She's worked in private, not-for-profit, public sectors. She's part of a project called the Brain Builders Lab, which is comprised of participants from across Canada, and they're looking at the practical application of brain science to trauma. She's involved with several volunteer organizations. They've all got a focus on community growth and development, adverse childhood experiences, transition to sustainable employment, and she's also a municipal councillor for the Village of Black Harbour, and I know that she is connected deeply to members of her community every single day, and she has very great knowledge to bring forward. Nancy Stewart is in health promotion in Wolfville, Nova Scotia, and she's part of the Health Communities team for the Nova Scotia Health Authority. She's really passionate about social justice, working towards creating greater equity, values working with populations who have lived experience with those systemic disparities. Her work with a community engagement approach includes a number of strategies. She does advocacy for poverty reduction, municipal healthy eating policy, restricting unhealthy marketing to children, impact to end-use homelessness. So her work is really applying that equity lens, that equity strategy across topics. It's the approach that she comes to all of her work with. So those are our two experts, and with that, I am going to ask Heather Chase to share a bit with us about her work.